As the number of cases keep growing, there are new concerns that hospitals will run out of vital equipment like masks, face shields, and of course those life-saving ventilators. Many medical experts, they've been sounding the alarm for a while now. The head of the largest hospital organization is warning of that shortage, especially if Americans do not take the precautions needed. And the Society of Critical Care Medicine says up to 1 million people in the U.S. may need a ventilator at some point, but the country has less than at a max 200,000 of them. Now, the doctor working in an ICU in Seattle, one of those who is concerned.
Worried that if this pandemic doesn't begin to slow down, we will get into a situation where we may not have enough resources.
Now, the president announced today that he was enacting the Defense Production Act. It gives the government expanded powers to instruct factories to produce medical supplies, including ventilators. He was asked about invoking this act.
Do you have some targets that you would like to see immediately spooled up under the act?
We have tremendous numbers of ventilators, but there's never been an instance like this where no matter what you have, it's not enough. That would be the case. We will be, it's being signed. It's essentially drawn, and I'm going to sign it in just a little while. If we need to use it, we'll be using it at full speed ahead.
You can legitimately wonder why we waited till past the middle of March to finally invoke this. But be that as it may, this is another looming question, of course, which is, where do we go from here? Will we turn into Italy, which is now overwhelmed its healthcare system? This chart, it shows the trajectories of cases in several countries, including Italy, which is the purple line going up the most sharp. Now, the bright red one, that is the United States, and we are where Italy was 100 days after the virus first got here. Will we explode with cases like Italy did? Could we flatten out the curve like South Korea, or may we end up somewhere in the middle? Bear in mind, Korea had a massive testing campaign from the outset. Of course, we did not. As things get worse here, many doctors are putting their patients' needs above their own. Barack Obama, he recognized one of the many medical heroes here, an emergency room physician who's moved into the garage of his own home so he can separate from his family but still treat his patients. Former president saying that we owe a debt of gratitude to our health professionals for their selflessness, and courage. Joining us now to discuss Dr. Linda Dahl. And Linda, to me, I saw a study that came out today, and it's from a branch of the NIH. It's from the National Institute of Allergy and Infectious Diseases. And they said in part here that in droplet form, this virus can live in the air for several hours, let alone for several days on certain surfaces. How much of this virus do we still not know about? How many unknowns are there still out there?
Oh, I think there are a tremendous number of unknowns. Also, we don't know how long we've been exposed in this country already, especially in a city like New York. And with this type of transmission, there is a good chance that a lot of us, and some people even say all of us, have been exposed already. But it's not different than many other viruses. It's in the coronavirus family. It's just that its spectrum of illness is so much broader. So instead of just having a 1 to 3 day cold, you can have a 2 to 14 day illness. It could be mild, it could be moderate, or it could be very severe and life-threatening.
I've spoken to quite a few people in the last couple of weeks, including doctors in Italy, talking about the reality of where they are. They don't have enough ventilators right now. They don't have enough even protective gear for themselves. And they're having to make triage decisions, frankly, unbelievably painful decisions. I know we're not there yet, but from a lot of people we speak to, we're not talking months from that possibility. It could even be in a faster curve. Do we have the protocols in place to make those impossible decisions? Who decides who gets what when confronted with some of those, we should probably talk honestly right now, very probable realities that we're going to be facing in hospitals in this country?
Yeah, I mean, there really isn't a protocol for anything like this because nothing like this has really happened. But I think, unlike Italy, I mean, I guess it's different in America, and this is my sense of my patients, that Americans and my patients tend to see the doctor earlier when they start having early symptoms, and there are ways to intervene. And maybe if you wait until people are very, very sick and then they show up at the hospital, then the life-saving measures are more extreme. I also have a concern that even if we have a lot of ventilators, who is going to operate the ventilators? We need respiratory technicians. Those patients need a different kind of monitoring. So it's really, I mean, I hope it doesn't come to that in this country, and I have faith in the medical system of this country that we can intervene earlier and be able to treat our patients so that it doesn't get to that point.
To that end, I know calls already out for medical professionals that are retired or that are working in private disciplines, whatever. Is the cavalry coming? And if you think about it, some doctor in his or her 70s, for example, going back to go treat, obviously the ill with this virus, they're in the highest risk group, or one of them at least here, from an elderly perspective. Tell me, is that already what's going on, that we're already reaching out to people that are retired to come back?
Not that I've seen, and I think in Seattle, for example, where they're kind of close to or reaching capacity, they're really dealing with a lot of it now. And what I actually walked through Manhattan yesterday to just get a sense of what's happening in the emergency rooms. They're busy, but it's not overwhelming yet. And I also was speaking to a friend who's a medical technician. So I think there are other people who can help, not just doctors. There are emergency medical technicians, there are physicians' assistants, respiratory therapists. So I think there are a lot of other healthcare professionals that could be available to help, not just doctors.
Finally, there's a lot of people that, especially around this time of year, will get a cough, or they'll get the sniffles or whatever else. Obviously, for precaution's sake, stay home from work. But what should they then do? I mean, you don't want to overwhelm an already overwhelmed medical system right now. But what are the first steps? Who should people call? What should they do? What can they take? What shouldn't they take? Give a little guidance, if you would.
Oh, I love this question too. And this is a general guideline, even though everybody's an individual and you have to know your own body and health to know if this is safe for you to take. But I'm recommending, especially because it's allergy season now, a lot of people are going to start coughing and sneezing and having very similar symptoms to the early viral symptoms just from allergies. So I'm recommending that all of my patients who even have a remote history of allergies start taking their antihistamines. I recommend in colder climates that people load up on vitamin D, because we're all pretty low on it from having been away from the sun for a good 6 months. And if you have enough vitamin D in your system, it really helps boost your immune system, so you're not as susceptible to getting sick from any kind of illness. I also recommend simple things like sinus rinses. You can gargle with hydrogen peroxide and obviously spit it out, because that oxidizes bacteria in your throat. And there are also saline rinses with natural oils like oregano oil and clove oil that you can use for sprays, and they're antiseptics as well. And those things, if you use them at home, they can really help boost your immunity. And then if you start getting symptomatic, you can take some of the over-the-counter medications, although there's some controversy about Advil.
Dr. Dahl, thank you so much for the time. I really appreciate it.
Thanks for having me.
All right, we keep talking about these cases. Well, when we come back, I'm going to introduce you to a man who just tested positive. He's going to join us. He's going through quarantine right now to talk about his experiences. He also happens to be a member of the New York City Council, so we'll also discuss what's going on in the city.